Why do some patients prefer ReLEx SMILE? Some patients prefer ReLEx SMILE because it's a very comfortable procedure. And it's comfortable in two ways. The laser that applies the SMILE treatment, the VisuMax SMILE treatment, has a very low suction effect on the eye, so it's barely perceptible. Some lasers used for LASIK, which create flaps, cause more pressure on the eye because the suction pressure is higher. So during the procedure, it's very comfortable and patients find it painless. And it's also very quick, so it's comfortable for patients. The other advantage is post-operatively. Many patients have SMILE because they're not suitable for LASIK, and the only alternative is a surface-based procedure, namely PRK or LASIK. With PRK or LASIK, the surface skin is loosened with alcohol and then slid off the surface of the eye and may or may be replaced. However, what that's essentially doing is inducing a scratch on the surface of the eye, and that takes 2 to 4 days to properly heal. During that 2 to 4 day period, the eyes are variably very gritty and watery, very sensitive to light, and may be in some patients quite painful. In addition, the vision is very blurred and the visual recovery is very slow. So I tell patients having a surface-based procedure that it would be 4 to 6 weeks before their vision is really crisp and they feel like they've got that fine-tuning. In contrast with SMILE, there is no pain post-operatively. The eye is very comfortable, rarely even a foreign body sensation, and the visual recovery is very quick. So you can see instantly, and for a period of 24-48 hours, it may be a little misty, but I would expect patients to be back at work within 48 hours, and by 72 hours, the vision really quite crisp. And certainly when I see patients at a week post-operatively, they're seeing, driving, working, which isn't always the case with surface treatments. So people prefer SMILE over a surface procedure because it's more comfortable and the visual recovery is quicker. As far as comparing SMILE with LASIK, LASIK is also painless during the procedure, although some lasers, the pressure can be higher, as I mentioned. But if the laser is performed with the VisuMax laser, the same one that we do SMILE with, it's painless. But if patients have a little bit of a dry eye, so many patients undergoing laser eye surgery are choosing to do that because they can no longer wear contact lenses. And the reason they can no longer wear contact lenses is because their eyes are dry. So they have a fundamentally dry eye, and they may be using artificial teardrops. Now in that group of patients, if they have LASIK, they will need to use many more frequent artificial teardrops after surgery, and they will be aware of the eyes being gritty and blurry because of a dry eye. Now because SMILE is essentially keyhole LASIK, the effect of surgery in making the dry eye worse temporarily is much less. So it's much more comfortable post-operatively for patients with a dry eye to have a SMILE procedure than it is a LASIK procedure. The visual recovery is essentially the same. In fact, with LASIK, it's probably 24 hours or so quicker than with SMILE, but it's much more comfortable.